Resources and Supervisor Wattenberger, very soon we will have a contracts registry with a compliance action report. So we will know all of the contracts in the agency, when they begin, when they end, what the dollar amount is, what the quality of that service is. Okay, so now here we are in 2008 facing a looming state budget crisis. The agency development now will carry us into a time of creative financing as we sustain these multiple programs and services that we provide to the community. Last year, without a lot of planning, the agency was able to leverage over $400,000 by integrating services. This year, as we plan for greater service integration, we know immediately that we could reduce mental health program costs by $300,000 simply by integrating adult programs that serve social services clients and mental health clients. So we're looking at frontline integrated services going forward. And as you may recall that in 06-07, our branch directors were also meeting with community partners and with the staff working on a comprehensive plan to determine the community needs and best practices. The outcome of that planning process was the conceptual development of the systems of care. So I'm here today to tell you that July 1 of 08, we're going to begin operationalizing our systems of care. Our expanding children's system of care, we're looking at children's mental health services being fully integrated into this model. And also in July of 2008, we're going to begin the adult systems of care integration. And what we're looking at is adult services in social services and adult services in mental health, and integrating those programs that make sense, those programs and services. Both of these branches have overlap in what they do and who they serve. And right now, the staff and our community partners are actually looking at the adult system of care approach and looking at what programs can be implemented. So just to summarize, our systems of care approach is the best way we find to organize a multidisciplinary team to respond to the needs of this community. What we started at with the agency development started out as a best practice model and a way to enhance our services to the community. It has now become the best approach to sustain the $105 million in services and programs that we offer to this community as we face these budgetary challenges, not only our own, but with what the state's dealing with. Our process as we go forward has been inclusive, will continue to be inclusive with the staff and the community partners. You'll hear about this over the next few months. You'll see us meeting with staff around the frontline integration. You'll see us meeting with community partners to gather more input. And on the side, we're actually working with the community clinics. We have a group with the community clinic system that's actually working on mental health services and how we can work together, how they can see more of our patients, how we can serve more of our patients. We're also looking at ways to create greater efficiencies, and this is by reduced county spending and leveraging more dollars to draw down federal match. When I talked about the $400,000 and the $300,000 this year, that's what we're talking about, is leveraging our funds as we integrate our services. There were a couple comments and questions that were asked throughout the course of the presentation. I'd just like to respond to them before I leave. The 21 FTEs that was talked about within the agency, 20 of those positions are within social services. This was a worst case scenario that we gave the CEO's office and the board. Currently in social services, as I said, 20 of those positions are in social services. We actually have a turnover rate of about 15%. The 20 FTEs add up to about 5% of the total staffing. So if we had budget cuts from the state and we had to reduce our staffing, we think we could absorb those positions with the vacant positions that we have. Also, there was a question regarding emergency medical services and Medi-Cal payments. We are researching that. We're not certain that the ambulances or emergency medical services in general, as long as they don't get to the emergency room, that system will actually be affected. We are researching that. It may just be the ER docs and the medical providers.
I hope so.
Yeah, we all do. So with that, I want to thank the board for your ongoing support with the agency development, certainly Mr. Mitchell and the CEO office as well, and of course our community partners, and not to mention all the good work that the staff has been doing, particularly our mental health staff who have been working short-staffed, really trying to see as many clients as they can. So thank you. Are there questions?
Thank you, Carmel. Supervisor Delaware.
Thank you, Mr. Chairman. No, I don't have a question. I have actually a comment, and I want to thank you for your comments and your approach to this. It's a huge agency, big bucks, very complex, but you have been able to take this and really make it viable from a community standpoint with the partners, and I just wanted to commend you for that, and looking at every way you can stretch those limited dollars as they become more limited and they need to become more elastic, and every piece of leverage we can get. Really, I want to thank you for taking that on, and your staff and everybody that's played a role in this. The two things that I'd like, and I'm sure you would be doing this anyway, but I'd throw them out there again, is to continue to look at that structure, particularly the parts that may not be as applicable to health and human services, such as environmental health, that has parts of that can be pulled out of HHSA and moved somewhere else in the planning side, as well as take a look at your consolidation and integration of the services on a geographic basis as well,
Yeah.
where we might be able to consolidate in order to continue to stretch those dollars. But thank you again for all the work. It's
Thank you for your
truly
comments.
appreciated.
Any other comments?
I can't say nothing. The chairman took away my pen.
I didn't break it. Carmel, I too want to thank you. I'm not quite sure you realized how big of a project this was when you took the job, but I do welcome you and continue to embrace your efforts to run an organization as large as this, and you've made great strides, and I truly believe 100% that we made the correct choice in bringing you here.
Thank you very much. I really appreciate that.
Any other comments to the board?
Thank you.
I believe we've gotten through the process, down to the last item, public expression. Any other comments to the CEO's office, the staff?
Well, I was going to,
Discussion you want to have at this point.
I think there was a
We
section
finished
we
at
had for
4:31.
board priorities, but I think you very eloquently have demonstrated what your priorities are throughout the discussion.
Yeah.
So I think we know those. The only thing I was going to say to you in conclusion, according to the LAO, if the governors did manage to solve this year's budget, in 2009-10, we're only looking at a $3.8 billion deficit. In 2010-11, a $2.9 billion deficit. In 2011-12, a $2.1 billion deficit. So I'm anticipating by 2012-13, the state will be in sound financial shape and will be able to move forward.
So much for projections.
Let's get 3 more of them papers. It's getting better every page. That's like reading Mickey Mouse or something. They put out something like that.
Johnny, you better get it all right now, because you can't talk tomorrow, all day. You used up
You
all your-
used up your time
You
allotment,
used up your
Supervisor.
quota.
Tomorrow will be a long day. We have a great number of important items to take up. I appreciate everyone's patience getting through this. This is the start of our process moving into this next year. We did have to have some discussion here in setting these guidelines and priorities, and I do appreciate everybody's comments. With that, we'll call this workshop adjourned.
It's called free.